Hi everyone, I'm Bronwyn Fitz, an integrative gynecologist and functional medicine doctor, and today I want to talk about COVID-19, the coronavirus pandemic that we're in the middle of, and quarantine and social distancing, and really what are we supposed to be doing to help this situation, especially those of us who are not sick. We're hearing a lot about the importance of social distancing, and I've really struggled with that, and I've kind of this morning I did a really deep dive and I just read a ton of articles in the medical journals and interviews with public health experts, really trying to wrap my head around this. And I think I have a little bit of clarity, so I wanted to kind of share it with you. So first, I just kind of want to talk about, quarantine versus social distancing, they're related. It's a continuum, right? Okay, so if someone is sick or you really suspect they have had an exposure to someone with COVID-19 or whatever illness you're trying to quarantine, you're trying to stop the spread of, you isolate that person, and that's complete isolation. You're totally trying to prevent the spread of that illness. And so you put that person in an isolation room. Anyone who goes near them, first of all, it's very limited who goes near them. Anyone who has to, a healthcare provider who looks in on them, is wearing protective gear, mask, gloves, gowns, the whole 9 yards. So the goal there is complete prevention of transmission of the virus. Now, in social distancing, which is what we've sort of been asked to do in a lot of communities around the country, I'm in Westchester County, we acknowledge there's going to be some spread of the virus, okay? So it's on the continuum, but we're not isolating so much. We're just isolating a little, okay? So part of me was sort of struggling with that. Like, why bother? A lot of the schools are closing. Kids are at home. A lot of us have questions like, can the kids see each other? Should I not go to the grocery store any longer? Can I go to work? All of these really important questions. So with social distancing, what we're just trying to do is decrease the rate at which the virus spreads. Okay, so cat's out of the bag. Like, we're in the middle of a pandemic. The virus is very contagious, and it's going to affect thousands, if not hundreds of thousands, if not millions of people. The problem with everyone getting sick at the same time is that we're going to overwhelm the healthcare system. Okay, there's only so many doctors and nurses, there's only so many hospital beds, only so many breathing machines. And what they've seen in other countries is that when too many people get sick at the same time, there aren't enough resources to go around, and that's when the death rate is really high. So we're in the pandemic. We know that lots of people are going to get this. What we're trying to do now is limit the damage. It's like damage control. Okay, cat's out of the bag. Thousands, if not millions of people are going to get this virus. What can we do to slow the spread of the virus so that not everyone is sick at the same time, so that we're not overwhelming the healthcare system and all the other resources we have to support our communities? So that's what this social distancing is. It took me a while to kind of really wrap my head around that. We know that we're still going to be exposing ourselves to the virus. So then the nuts and bolts of like, what can I do? What should I not do? Ultimately, it really is going to vary from person to person, family to family, community to community. In communities where there's a lot of illness, social distancing might be a little bit more extreme than in communities where there's less illness. So the first thing is we do need to obey or respect the guidance we're getting from our local public health officials. And if people are implementing certain travel bans or restrictions of groups of people over 500 and shouldn't meet and things like that, then we really need to honor that. In terms of kind of the day-to-day decisions, can my child who's out of school for the next 2 weeks and doing online remote learning, can they go next door and play with their neighbor after school? Can I go to the grocery store? Can I go to work? Can I go to the library and get the book that my child needs for their assignment? This is a judgment call. right? So it really is a judgment call. Everyone's going to have to determine for their own safety, for their own, out of respect for the safety of their family members and their community members, how much contact you want to have. Do recognize that the more contact we have with other people, the more likely we are going to be exposed to the virus and get it and pass it on. The more isolation we have, the less exposure we're going to have to the virus. At this point, it really is about slowing down the spread of the virus. We do want to protect the most vulnerable people. The people who are getting the most sick from this virus are the elderly and the chronically ill. So certainly social distancing in the context of the elderly needs to be much more extreme than kids. It is a judgment call. Hopefully we're all going to act responsibly, respectfully. Hopefully we're going to continue to remember our neighbors, reach out to those who might be in isolation, offer support, try as much as we can to responsibly support our local business owners. The economy is kind of taking a hit right now. Do everything we can to responsibly support our local communities and businesses, and everyone just stay as healthy as they can. If you're feeling unwell, stay home. That's the bottom line. The COVID-19 virus does tend to present with fever and cough as the main symptoms, but it can also have chills and body aches and runny nose, sore throat, diarrhea. It kind of runs the gamut. I mean, I did a deep dive and I looked at lots of case reports published from the experience in Wuhan, China, and the way people present when they get sick can almost mimic the flu, initially the common cold, even allergies. People had watery eyes. So it's really tricky, and because we don't have access to tests very readily yet, I would err on this side of caution. If you're not feeling well for any reason, why risk it? Just stay home. Just stay home. So with all that, I also want to encourage people to eat well, sleep well, try to maintain your sanity and be mindful of how stress is impacting our bodies, and we'll just kind of try to stay smart and stay healthy and stay strong, and we'll get through this.